Hey, everybody, I'd like to welcome you to another episode of the House of Bricks Live. We continue to feature best-in-class people, top CEOs, entrepreneurs, have some great guests later this week that you're going to want to check out. And over the last couple of weeks, we've been featuring some of our founders in our StartupX program. So if you haven't heard about it, we are running an internal accelerator program with 12 companies, and 6 of those are going to get a once-in-a-lifetime opportunity to be on the 2-minute drill with myself, David Meltzer, a celebrity judge, and we're adding one more. And we're really looking forward to today's guest, someone I've known for a long time. We've traveled different paths of being entrepreneurs, but achieved success through failing over and over again. That's all we talk about at the House of Bricks, but we use those failures as a competitive advantage. So today I'd like to welcome a good friend of mine, an entrepreneur, Fox Holt. Welcome to the House of Bricks Live.
Appreciate it, Adam. Great to be here, man.
Great to have you. And I know you have a lot to share with people, and I'd love to hear a little bit more about you. And I like people to introduce themselves, because some people are like, oh, I'm a best-selling author, I'm the best. And other people like, dude, I failed all the time. I just got freaking lucky. So I'll let you tell us how you want to describe yourself.
Sure. Appreciate it. So right now I'm the CEO of Vigilant. We're a company that is digitizing the last mile of drug delivery. We're trying to automate a lot of manual, error-prone steps that nurses have to perform when delivering medications in hospitals. So we're on a mission to eliminate medication administration errors in hospitals. Over like the past 17 years since graduating Cornell's business school, I've been an entrepreneur. Like yourself, a lot of different industries, starting with very sophisticated technology from Cornell's nanofab labs in organic electronics, company that took me to China, doing business work with companies like Samsung, LG, Panasonic, to then in the cryptocurrency space, which was a wild ride, doing an ICO with a coin and blockchain, Internet of Things startup, and finally here at Vigilant. Vigilant is, selling to the healthcare space, obviously. In its own way, it's by far more rewarding, not only because of the financial upside for myself and my investors, but the amazing things that we're doing for America, society. Helping to reduce pain and suffering associated with errors, giving back 18 million hours to nurses throughout all the American hospitals. But in its own way, it's also extremely challenging, because healthcare is a tough place to have a lot of change quickly. So it's a lot. It's got its own frustrations. Let's just put it that way.
Yeah, for sure. And I'll speak to just a couple of things you said. One of the most overrated things in business is actually business experience. So I know, super smart guy, went, Cornell Business School, but specific experience in those different businesses, you probably didn't have a deep understanding, but there are patterns in business, right? Things that happen in whatever industry, and if you follow and recognize those, you can find a way to create disruption in the market. And there's 2 people suffering in healthcare. One is the patients, and 2 is the people trying to do business within healthcare. So I share your pain there with my business. Metrics, we eventually ended up taking public, but it was an absolute grind. And so what right now is the big problem that you're trying to solve, and what's the impact?
Yeah, so kind of in hospitals today, 35 to 40% of medications, nurses are required to do a lot of manual steps, like handwriting on stickers in order to apply them to either syringes, IV tubes, infusion bags. And they have to do mental calculations, like right now, what's now plus 96 hours? That's an expiration time of an IV tube. Like, right? Shit, I don't know. Like, doing this math. And meanwhile, they've got beeps, buzzes, and patients needing help, and it's a disaster. So we've kind of found this very important niche, and we've automated these steps. And helping these nurses give back a lot of time and make sure that there's a double check in the process, and it's having a significant impact. Tremendous exciting.
Yeah, I was going to ask you. So there's a lot of problems, right, that you can solve in healthcare. You have a specific niche, and it's a real problem, right? It's tough to imagine that that's still how things are being done. So did you? How are you able to narrow the niche? Because a lot of entrepreneurs struggle with that. Okay, what is my ICP? What problem do I want to solve? And it's a big problem, right? And there is a big problem to solve, but you can't solve everything at once. So how did you narrow in on that specific pain point you wanted to solve?
Yeah, it's a great question, because it's, we have a platform technology that is applicable to all sorts of different places in the hospital, from the pharmacy to emergency rooms. And, it's kind of finding that first customer, really going on that journey with them, digging in and understanding the value that brings. I mean, there's so many technologies that can benefit hospitals. Hospital administrators are really inundated with all sorts of different technologies that can be applicable. I mean, they could spend $1 billion without blinking an eye, and obviously they don't have it. So, for example, when Vigilant, we were deploying our first 25 customers, I personally went to those hospitals to deploy them and to interview the nurses and understand the value and kind of tweak the product and understand that. So I think to answer your question, it's really spending time with the customers to understand the value it's bringing, and understanding if we can repeat this product over and over again through a lot of different customers.
Well, even though you weren't in our StartupX program yet, I'll take credit for that, because that's what we teach people. Okay, stop trying to build an MVP. Okay, everyone tries to rush to market with an MVP. I got to have my minimum viable product. You either spend too long building it and the opportunity passes, or you build something and it's completely wrong, right? So you got to get close to your customer, find out what problems you can solve, break it down into micro problems, and then start to get traction with them, because they're going to help you build the best product. And I know in healthcare, it's a very long and difficult sales cycle. And as an entrepreneur, you're worried about, right, cash and sales. That's all you're worried about. I've talked to hundreds of founders in the last year, and just know this in general. You ask them, what's your biggest constraint? It's sales, and I need to raise capital. But how have you been able to, and I know you've raised some money already, just balance a long sales cycle and still manage cash? Because I know your company's profitable. You've doubled revenue year over year. So you're on the right track.
Well, it's finding ways to shorten the sales cycle. For instance, I think one of the toughest parts of healthcare IT sales is dealing with the IT departments, right? And they have significant challenges keeping patient safety information secure, not getting hacked, all these different devices. They've got a significant challenge. And so that's the bottleneck. And so we developed a product where the base level product doesn't need to go on the hospital network. And so it's kind of a standalone device that makes this impact. Additionally, we have full FDA databases of medications in these little kiosk machines. And so being able to really speed that cycle, finding what is the bottleneck and kind of eliminating that for the customer, right? Making it not only easy for their nurses to use, but also making it easy for the nurse management to purchase the product and implement it. Of course, we can implement in the IT department and provide a tremendous amount more value when it is networked, but it's a way for us to move really fast comparatively. And, we've had sales cycles, the fastest sales cycle is 2 hours, right?
Wow.
A customer had budget at the end of the quarter. They saw the product, they looked at it, and they said, we're gonna spend $50,000 on it. The challenge now that we have is getting that at the system level, and really, as I said, shining above all the other technologies, artificial intelligence, predictive analytics, robotics. And that's the challenge that we deal with, but we'll make it for sure.
And are you going to continue to sell into IT? Is that, or that's just where you started? Are you going to try other entry points?
Oh yeah, absolutely. Well, in fact, we don't sell into IT. Anybody who sells a product, you always try to get that line of business to be bought in first, right? Because IT, they usually have a long laundry list of things that they have to do and that they want to do and they want to control. And they don't necessarily know as much about that line of business and what's important. And when they have nurses screaming, saying, we have to have this, it becomes priorities. And so we have to work with IT, but and we like working with IT. It's just they got a lot of things going on.
Any IT clients of Fox's out there, they're not hating on them. I've got them too. And I used to tell them, like, they would just think of ways why they should not do it, right? I live my life in finding why not. They're like, why would I do this? I've got a lot of things to do. It just adds to their to-do list. So speaking to long sales cycles, you've had some as short as, a couple hours, probably an anomaly in healthcare. One of the things that I know people struggle with in selling into healthcare is how do you stay relevant and top of mind so when it is the right time that you're in the game, you're in the mix?
It's a tough question. You're always kind of looking at the industry, what challenges hospitals have, and trying to tweak the message to fit whatever challenges they have. And sometimes I wish we would have been a couple of years earlier, right? Because COVID hit and nurses, and especially in the ICU, had needed all the help they could get. And had we been there at that point, we wouldn't be talking here today, right?
Right.
But it's just always constantly making sure that we're developing the products and we're marketing them in the way that will benefit the hospitals.
In healthcare, I know there's a lot of compliance and regulatory challenges. So again, just different industries have different problems and red tape you may have to get around. Are you facing any of that with your product?
No, fortunately not. We've kind of got a niche there that doesn't need to fit into FDA guidelines per se. So we've been very lucky there. In fact, it kind of benefits us, right? So the Institute of Safe Medication Practice, ISMP, is a very strong third-party organization that sets a lot of the guidelines, and they're recommending using products like Vigilant by 2025. And usually those joint commissions and those organizations, follow what they say. So it actually could be a real benefit for us. But we don't like to sell on just compliance, right? We want to sell on the patient safety, the nurse efficiency, what kind of ROI it's going to have. Not, hey, you need this in order to be compliant. It's helpful, but we want to make sure the other fundamentals are there.
So we talk a lot about mindset in the House of Bricks and the StartupX program, and you've been doing this as long as I have. You've had some great success. How do you keep your mindset fresh and renewed to keep plugging away every day?
Have a short memory for the losses, or what is it, Ted Lasso? Be a butterfly or something. Just let the losses kind of roll for reasons that are kind of not for you, right? I mean, hey, we just ran out of capital budget for this year, or we'll try again next year, and just keeping on plowing and connecting with those customers, right? So as I said, I went to those first 25 customer sites and hearing the nurses' feedback, things like, oh my God, where's this been? And, oh, this is going to be the standard of care. This is going to help me so much. And just the excitement, the brightness that these nurses give. And think about the critical care nurses. These are, they want to spend every day helping heal the sickest of the sick in America. And knowing that you are making their job easier, kind of going back to that and knowing that, hey, we're doing something here. So when we do get a no, maybe capital budget reasons for next year, kind of going back to that is tremendously helpful. component.
Yeah, I just posted this last week, a clip from the Field of Dreams. I think we're dating ourselves, especially when I saw the actual clip from the movie. But being a successful entrepreneur, it's just all about easing his pain, right? Find that client, find that prospect customer, and ease the pain. And then you just get traction. People want you to either give them something they don't have or take away something they don't want to have. Those are the two things you focus on, and you're going to be successful and get traction. So getting back into your business, and then I want to tie into the overall vision. You've done something most startups aren't able to do. You actually raised capital successfully. Who were some of your first investors? Were they friends, family, angel groups, and how were you able to get them to buy in? Because it was a while ago that they invested. You weren't as far along as you are now. So how'd you paint that picture of where you want to go, and who were some of your initial investors? What types?
Yeah, I think that obviously there was a little bit of friends and family, but connecting with doctors and hospitals who were very familiar with the problems, not needing to sell the investor on, does the problem really exist? And our approach, is that good, or will it be beneficial to the clinicians? But understanding and selling them on just the financial upside of it. And so being able to reduce the amount of challenges to overcome with those investors, picking the right investors, right? I mean, doctors see these things every day. They've got cash flows, right? They're not poor. And so finding those right investors who understand the problem, who understand that our solution will be tremendously impactful, and then kind of selling them on the potential investment and the upsides.
Yeah, one thing I tell people all the time is money doesn't lead, it follows vision. So if you create, money's always available. You don't have the right vision, story, compelling reason of why they should invest. Money exchanges hands every day. It's just, where's it going to go? And as an entrepreneur, being able to create that vision early. And then something else you mentioned is so important. The most important type of capital you can get is strategic capital. So once people write you a check, I don't care if it's for $10 or $10 million, they're putting an investment in and they want to see it return. You have their attention. So you can form an advisory board and give them some equity. They'll have, some interest in opening up their relationships, but once that money exchanges hands, they're vested and they want to see you win. And I know I mentioned this earlier. You've doubled revenue year over year. You're not raising capital right now because you're in a good place. I mean, you're cash flow positive. Again, we're just checking away things that you've done with this business that many startups have not done. 9 out of 10 fail. Each checkpoint that you've accomplished is obviously reducing that failure rate. What's your overall vision for the company?
Oh, we definitely want to be the standard of care in all American hospitals. We have little nuances of the product that are good for every area of the hospital. And so having our product in the operating rooms, in ICUs, emergency rooms, pharmacies, just having a platform where we are recognized as an important component, right? That's kind of the overarching theme is just trying to give that 18 million nursing hours back, and being kind of a critical component in the medication administration process in hospitals.
So you passed the test. That was a trick question. You didn't say, I want to exit my business in 3 years. So every entrepreneur, they start a business, they're like, oh, I want to exit in 3 years. Well, I can promise you, predicting the weather is easier than predicting when you're going to exit a business. It depends, right? You have to listen to the market, raise capital if you need it, get it in at certain valuations, get it in at the right valuation. I've seen a lot of entrepreneurs try to hit a home run on the Series A and then end up not performing, doing a down round, and you're just digging yourself out of a massive hole. So it's
Right.
having the right strategy, bootstrap, get traction, friends and family, seed money, angel money, Series A, and then you will really have a strong foundation that's going to position you for a high value exit at the right time. You just never know when the right buyer is going to come along. So you have to be ready, and that's not skipping a lot of the shortcuts that entrepreneurs take in the beginning, like not having the right operating agreement or shareholder agreement. Like, I'll just go on LegalZoom and make it. Well, that's going to cost you millions of dollars on the exit. I can promise you, and create a nightmare that you can't unwind. And so, look, we've covered your journey as an entrepreneur, the current business. One of the things we're really focused on in the House of Bricks is the impact, right? What impact are you making outside of revenue? Look, there's nothing wrong with growing a successful business and making money. Money makes life easier if you have the right foundation, of course. But what's kind of the impact and vision you're trying to create outside of the business itself?
Yeah, I've said it a couple of times. It first starts with making the nurse's job easier. Right now in America, we have a massive nursing shortage, and there's a lot of industry people who say it's only going to get worse. Not a lot of the new generation want to do that path, and so making it easier for those people who were there and removing that burden is very important. But also, of course, making the patient's journey in the hospitals safer and just more enjoyable by giving back $18 million nursing hours, or per hospital 3,000 nursing hours per year, allows them to do other things, to spend more time with the patients and patients' family and loved ones, having better bedside manner. It's tremendous. And then reducing the hospital-acquired infections, right? Think about a loved one going in the hospital and getting an infection while they're there, and all the pain and suffering, reducing those, because all the medications are labeled and changed properly in the timing. So it has kind of a cascading impact effect when you're giving more time back and more resources to the hospitals.
Well, and if I could just add to that, right?
Love it.
It's creating a happy workplace, right? Nurses want to do a good job. They want to make an impact in patients' lives. They're not in it for the money, for the time and stress that the healthcare industry is in. Most of them are severely underpaid. So, solving that problem, simplifying it, making it easy, better experience for patients. And I don't know the statistics now, but I know one of the leading causes of death in a hospital is misdiagnosis. So how much is a person's loved one's life worth? It's priceless. Yeah. So what you're doing, it's not just, it's not a small problem you're solving just to make things easy. You're actually saving lives from my perspective, and creating creating a better work culture. I've been with 4 boys in hockey. I've been in the hospital ER more times than I want over the last 4 or 5 years, and it's terrible.
Yes,
it does not go well. No matter what kind of insurance you have, where you go, it's just a very difficult experience. It's not tied specifically to the problem you're solving, but every problem we can solve can make it a bigger experience. So I see those as 2 priceless impacts that you're making. Any closing thoughts for our listeners today? I really appreciate you jumping on.
Yeah, if anybody, we're actually hiring sales people right now. So if you know somebody, or you're very interested in selling this product and making this impact, please reach out. If you know somebody in kind of a healthcare innovation space, send along our information. We have a fairly immediate impact in the hospitals, and anybody who can help along the way would be wonderful. So that's kind of the main share and ask that I would have for this community, right? We always got to kind of depend on the entrepreneurial community and advisors, and so would love any help that we could get in this journey.
See, I love it. Entrepreneur, baby. Always making the ask. There you go. You want to be a part of this? Jump on board, man. We've doubled year over year. We're solving a massive problem. We're saving lives. So I love it. You did mention one thing, and we'll close out with this. You've been a member of the House of Bricks community now for a couple of months, and again, super seasoned entrepreneur. What have you kind of felt as some of the big takeaways of being a part of the House of Bricks?
Oh, it's tremendously important to be a part of community, and being a part of a group of people who are all kind of going through the same process, different industries. It's very, very similar. And, you know, you get stuck in the weeds sometimes, right? And pulling up and looking at the forest per se. I know it's a, overused analogy, but having those communications and kind of really sharpening the skills and hearing things from other people's perspectives, it kind of opens your mind and makes sure you're on the right path. It's tremendously important in this journey. Every startup that I've been in, I've had a group of kind of not advisors, but people around me where I'm asking a little bit of questions and, hey, what would you do about this? And what would you do about that? And as well as answering them, because as I'm answering those questions for other people, it's kind of spurring other thoughts sometimes. So it's tremendously important. House of Bricks has been spectacular.
Well, I appreciate you saying that. It's been a ton of work building this, but you see we're growing every day and making an impact, empowering entrepreneurs like you. And you actually got that tree and forest analogy right, or whatever they say. I'm always like, forest, tree, whatever.
I almost botched it.
I know. It's still trying to figure out if I'm lost in a forest. I got hit by a tree. So, but anyway, Fox, I want to thank you for joining the House of Bricks Live. Everyone out there, if you want to get connected with Fox, even just learning about his business, but someone to build your network with, we're going to put his LinkedIn profile in the chat. And like to thank everyone for their time today. And if you want to learn more about the House of Bricks, you know exactly where to find me. So thank you, everybody, for joining. Fox, thank you again, and best of luck in the 2-minute drill. I want to see you on the finals.
Thank you, sir.